In November 2016, one of the biggest artists on the planet was mid-tour, sold-out shows, 50,000 people a night. Then, abruptly, the tour was canceled. He was hospitalized, placed on a psychiatric hold. The public didn't understand what had happened. Many laughed, many mocked. Very few understood that what they were watching, in real time, was a manic episode severe enough to require emergency psychiatric care. His name is Kanye West, and his story, messy, public, painful, and still unfolding, is one of the most documented examples of what bipolar disorder actually looks like when no one is treating it. Around 50 million people worldwide are living with this condition. Most of them have never been in a stadium, but many of them know exactly what that collapse feels like.
Snacks.
Bipolar disorder is a chronic mental health condition defined by extreme shifts in mood, energy, and behavior. Episodes that sit at two opposite ends of the emotional spectrum. The first is mania. During a manic episode, a person can feel euphoric, grandiose, and unstoppable. Their thoughts race. They barely sleep but feel fine, energized even. They make impulsive decisions, big ones, financial ones, sometimes dangerous ones. Then comes the other pole, depression. A bipolar depressive episode can look almost identical to major depression: persistent low mood, exhaustion, loss of interest in everything, difficulty concentrating, a feeling of being trapped inside yourself. Between episodes, many people with bipolar disorder function well, what clinicians call euthymia, but for most, those episodes return. Studies show that over 90% of people with bipolar disorder experience a recurrence of illness. There are three main types. Bipolar 1, the most severe, involves full manic episodes, sometimes with psychosis. Bipolar 2 involves hypomania, a milder elevated state, alongside major depression. And cyclothymia is a chronic lower-level cycling pattern. Each one is different. Each one is real. So, what's actually going on inside the brain? Researchers are honest about this. The full picture isn't complete yet, but what we do know is significant. And it completely reframes how we should think about this condition. Bipolar disorder involves disruptions across multiple neurotransmitter systems: dopamine, serotonin, norepinephrine, glutamate, and GABA. During mania, dopamine activity appears elevated. That drives the euphoria, the energy, the impulsivity. During depression, the balance shifts the other direction. Brain imaging consistently shows reduced connectivity between the prefrontal cortex, the brain's decision-making and emotional regulation center, and the limbic system, particularly the amygdala. In a healthy brain, the prefrontal cortex acts like a brake pedal on extreme emotions. In bipolar disorder, that brake is inconsistent. Genetics also plays a major role. Studies of identical twins show that if one twin has bipolar disorder, the other has roughly a 40 to 70% chance of also developing it, pointing clearly to biology, while also confirming that genes alone don't tell the whole story. Here's where the title of this documentary earns its name. Most people with bipolar disorder don't walk into a doctor's office during a manic episode. They walk in during the crash, exhausted, low, struggling. And what does that look like to a clinician? Depression. So that's often what gets diagnosed. The hypomanic or manic phases can genuinely feel good, productive, creative, alive. People don't report them. Sometimes they don't even recognize them as symptoms. So the full picture never gets told. The result? Most patients with bipolar disorder are not correctly diagnosed until 6 to 10 years after their first contact with a healthcare provider. The most common misdiagnosis is major depressive disorder. Others include anxiety disorders, personality disorders, and ADHD. There's also no blood test, no definitive scan. Diagnosis is entirely clinical, built from a detailed history, observed patterns over time, and ideally, conversations with people who've watched the person for years. And a gender bias compounds everything. Women are more likely to be misdiagnosed with depression, men with schizophrenia. Living with bipolar disorder isn't just about the episodes. It's about navigating the space between them, the uncertainty, the question of when the next one might come. Sleep disruption is both a major trigger and a major symptom. Research consistently shows that irregular sleep and social routines can directly precipitate manic or depressive episodes, a transatlantic flight, a string of late nights, a period of intense stress. In someone with bipolar disorder, these aren't just inconveniences, they can be the spark. Bipolar disorder rarely arrives alone. More than 90% of people with the condition have at least one other mental health diagnosis. Most commonly, anxiety, impulse control disorders, or substance use disorders. Nearly half are estimated to develop an alcohol use disorder at some point. This is the part that matters most. Bipolar disorder is treatable. With the right combination of support, many people live stable, full lives. Medication is typically the cornerstone. Lithium, one of psychiatry's oldest and most studied drugs, remains a first-line treatment for many people, particularly for mania and for reducing suicide risk. Mood stabilizers like lamotrigine, and atypical antipsychotics, including quetiapine and aripiprazole, are also widely used across different phases of the illness. Psychotherapy, particularly cognitive behavioral therapy and psychoeducation, is strongly recommended alongside medication. Learning to recognize early warning signs, protecting sleep, and building a consistent routine. These are not soft suggestions. They are evidence-based strategies with measurable outcomes. Kanye West's story is still being written. His diagnosis has shifted, been disputed, been public, been painful. In many ways, that messiness is the point, because that's what this condition actually looks like. It doesn't come with a clean label and a clear ending. Bipolar disorder affects tens of millions of people. It is misunderstood, frequently misdiagnosed, and carries enormous stigma. But it is not a personality flaw. It is not a lack of discipline or willpower. It is a complex biological condition rooted in the brain, one that science is still working to fully understand. The disorder doctors keep getting wrong doesn't have to be the disorder you get wrong too. Know the signs, ask the questions. And if you've been told it's just depression, it might be worth asking what else it could be.